Hello, everyone, and welcome to SCB Means Business, the podcast where we meet the leaders of great companies who are making a difference in their community. I'm your host, Holly Schroeder, and today my guest is Dr. Mark Leiker. Dr. Leiker is a well-known neurosurgeon here in the Santa Clarita Valley, but today we're here to talk about a new venture called the BrainStim Center. So welcome, Mark. Thanks for joining me today. Appreciate it. Can I call you Mark, not Dr. Leiker? Sounds so formal.
Yeah, absolutely, Holly. It's a pleasure to be here. Thank you for having me.
That's great. That's great. Okay, so when we discussed in the prep that this new center offers a therapy called transcranial magnetic stimulation. So let's start by you describing what that therapy is, who uses it, where it came from. Just kind of give us the basics 101 on what sounds really complicated.
Sure. Well, the opportunity that we bring to the community is using something called transcranial magnetic stimulation, which is a way of non-invasively stimulating the surface of the brain. It has lasting effects. It's a long-standing modality. And I got interested in this because for a number of reasons. First of all, I'm a brain guy. I'm a neurosurgeon. I'm also a brain circuitry guy. Now, in Santa Clarita, I don't do something called deep brain stimulation. I do that type of surgery, which involves placing electrodes in the brain down at USC and at Children's Hospital of LA and Orange County. That's kind of my hobby. It's my super subspecialty. I really enjoy doing it. And basically what it is it involves putting an electrode or a number of electrodes in the brain to improve an abnormal circuit. And I'd heard about TMS for a long time and then came upon it again because they developed some new technologies that involve navigating the brain, involve treating certain areas of the brain using brain navigation. Before, the only way to use TMS was basically to measure certain contours of the brain and to use the stimulation on an area that was basically within a certain measured region from another area. And I thought it was not very specific. So I got involved because I thought it would be really exciting to bring a new technology that would help modify or modulate abnormal circuits in the brain and do it non-invasively.
Yeah, so you talk about circuits in the brain working normally or abnormally. I mean, just to elaborate on that, what does that mean? And maybe what's a parallel to another part of the body where something is the same? How do we get our head around that, literally?
Literally, yeah. So, So when you think about, so kind of stepping back to, what I know about the brain, how it works, how the circuitry works, give you a really good example. So I treat patients with Parkinson's disease with deep brain stimulation. So I drill a couple of holes in the skull, place the electrodes, and so I'm changing the output of an abnormal brain circuit using electrodes that historically have been treated with medication. If you know anyone with Parkinson's disease, they're undoubtedly on a medication that helps them with their movement. So I have nothing to do with the chemistry, the neurochemistry of the brain. I put electrodes in, and that changes the output of an abnormal circuit. It actually changes the abnormal oscillations of an abnormal circuit in the brain. And so the parallel to this is a lot of us have a variety of issues, psychological, cognitive issues, that especially have come out recently with COVID. And that was the other impetus for me to get involved in this. And those patterns of behavior, let's say, are caused by abnormal circuitry in the brain. We've learned a lot about this abnormal circuitry, for instance, in the areas of depression and OCD, addictive behavior, everything from sleep disorders to ADD, they all involve an abnormal circuit or a circuit that's become abnormal in the brain. And what TMS does, at least guided TMS or targeted TMS, is it rectifies or modifies or modulates that abnormal circuit to make it more normal. So one of the critical things that we do when we evaluate any patient with any of those problems, again, from depression to anxiety to ADD, sleep disorders, OCD, and I think I mentioned ADD, is we obtain a baseline EEG, and we evaluate that EEG by using certain software packages that look at the oscillations and identify that something is wrong, and identify where that's wrong, and then personalize the treatment using TMS to rectify that circuit.
Wow. That's cool.
So that's a lot of stuff. But basically, we get into patterns of behavior. That behavior can be modified, or that entity can be modified using drugs. But we know that depression, anxiety, sleep problems, addictive problems, they're just rampant nowadays, despite all the drugs that all the doctors, and I'm not downplaying it, I'm a doctor myself, and there's a role for the medications. But for so many people, there's a limit to the effectiveness of the medication, and the medications have sometimes pretty significant side effects. And
yeah, so this, you say, is personalized, to what's going on in an individual's brain. So unlike medications, which are a little bit, they're treating the issue, but they may come with side effects or consequences. And this would be maybe avoid some of that.
Right. This is non-invasive, no side effects, and it's long-lasting. It lasts a long time, and you don't need necessarily to take let's say the volume of medications that you might have to. So I got very excited about this for a variety of reasons. Personally speaking, my son has ADD, and he was on all these medications, and that started to affect his sleep. And he's a student at USC, and it's very difficult. When you have this burden to get through your studies. And so we started to treat him for the ADD and for the sleep, and and he's had dramatic improvements. On our website we have a number of other kids. I mean, we treat adults and kids, but you see it so profoundly with the kids, especially because when you intervene and improve the potential for a 13-year-old, it's dramatic. And for instance, one of the kids we treated came from New York. Her mom's a pediatrician, and her mom obviously sees all these kids and their families, and they talk about how their kids are really having a hard time. They have ADD, they have trouble focusing, they're moody, they seem depressed, although kids express depression a little bit differently. Their grades are falling. And she came out and she spent really a month and a half, because it's a series of treatments. You need at least 30 treatments to really get an effect. And this is a pediatrician's daughter. She was skeptical because this is not really in the mainstream yet. We're trying to bring it out, for people to be aware of it. And she was, she calls it about as close to a miracle. I hate that word miracle, but she really, it was a sea change in her daughter's attitude.
Wow.
And her grades picked up, and she's, friendly, and she's back with her colleagues now. And when you think about the kind of impact that holds, and someone who's 13 years old is having trouble in school, medications, they really aren't working. What's the life trajectory for that kid? With potentially, school problems, and that doesn't go away. And if you can change that kid's life, it changes. Think about what that child would be, 30, 40, 50 years from now if you put her on the right trajectory. It's dramatic.
Changes
so
everything.
We've been really excited.
Yeah. So So you said, like, for that example of that child who, or teenager who, it sounds like responded really fantastically, and that's such a great story. You said like 30 treatments over 6 weeks or something like that. What is a treatment? I mean, if I were to come to your center, what do I see? You said it's non-invasive. So, I mean, am I going and getting is this like somebody gives me a brain massage? What is this like?
Yeah. Well, we like the concept of a spa-like atmosphere because, as a doctor, I know patients are very threatened, anxious by showing up at a doctor's office and what's going to happen, and it's anxiety provoking. So we have a kind of a spa-like atmosphere. I think it's a very friendly atmosphere. But what we start with is an EEG, and it's very comfortable. Obviously, not painful. Electroencephalograms are very common diagnostic tools. We also do something called a Cambridge brain test, which evaluates some psychometrics, psychological profile, gives us a sense of where things are. And then we also need an MRI because this is a brain navigated treatment. We have to be able to target a very specific area of the brain, and we have to do it in a reproducible fashion. We have to do it every time in the same location to get the same effect. And so once the EEG is done, we review the EEG. I'll speak with the patient about what the results show, and then we define the appropriate treatment paradigm for that patient, and everybody's different. So then we start the treatment. You're basically sitting, if you go on the website, BrainStimCenters.com, there's a picture of the chair. It's like a really nice dentist chair, and very comfortable, extra padding. And we have a variety of, we have a few technicians that are expert at doing this, and so they're there with the patient. They put this large magnet just on top of the hair, just on top of the scalp. It doesn't hurt at all, and the treatment lasts. It depends on a variety of things, but the treatment can last from 5 minutes to about 30 minutes. So it's not it's not uncomfortable. It's not annoying. You're sitting there in a chair. You're relaxing. You can't fall asleep, but it's a very relaxing environment. Then you go home, and actually, for the first week, you may feel some mild headaches. You may be a little bit more fatigued than normal. That's an expected result in the first week. And then you may notice after about 10 sessions that there is some change, some improvement. And we do get another electroencephalogram after 10 treatment sessions, and we can hopefully see that there are changes, that there are what we call neurophysiological changes, actual changes in your brain pattern after the 10 treatment sessions.
So you would actually see that on the EEG, like or the MRI, you would see that the synapses are working different, talking to each other different? Or
Yep. Not on the MRI. The MRI is an anatomic study, but on the EEG, which is neurophysiological, the EEG tells you how the neurons in the brain are communicating with one another.
Wow.
And so we'll see those changes. I think that the brain likes to be in a normal, healthy pattern, and we develop these abnormal patterns for whatever reason. We don't really understand it. Obviously, let's say in a case of autism, those patterns are developmental. Those connections are developmental. But in the case of let's say sleep disorders, those are probably something that is created over time based on medication, based on habits, based on environment, things of that sort. So that all makes sense. And we have a partnership with an organization that's based down in Newport, and they do treat autistic kids. We'll be starting to do that as well. But the purpose of my communication is to think about the brain, and this is what I've been doing my whole professional life. Think about the brain as a series of circuits. rather than a loss of some molecule, some neurotransmitter. And again, I'm not putting down the pharmaceutical the pharmaceutical
Industry.
industry, but they have their role. But I think the appropriate treatment for any patient with any kind of cognitive or behavioral problems isn't. It shouldn't only be here's a pill. Of course, psychologists have a huge role in this as well. But it's very difficult to change the patterns of behavior without also changing the underlying circuitry.
Well, and
And that's
the amount we know about that circuitry and how the brain works, and the equipment to detect it and understand it is, I mean, it's advanced so dramatically in the past couple of decades, right? And so it's paralleling what happened in pharmaceuticals in some ways in terms of advancements.
yes, absolutely. Pharmaceuticals, any new development in pharmaceuticals goes right to the mainstream because they have the power of marketing. For these more these more technologically based devices, without all the marketing budget, it's just me. I mean, I think I'm probably the only one, and I'm definitely the only neurosurgeon that's doing this. There are a few centers around the country. I think there are about 6 or 7. But I'm the only neurosurgeon because I'm interested in the circuitry. That's really, that's what I enjoy doing. That's my kind of super subspecialty. But I think, treating any of these so-called diseases, I mean, obviously depression is a disease, and anxiety, ADD, those are all diseases. I think, the message I'd like to get across is that this is not just, give me a pill. It's give me a pill. It's treat the underlying circuitry. It's maybe psychological help with cognitive behavioral therapy, things of that sort. So it's really a multimodality, and I'm just providing what I know in terms of my subspecialty into the mix to help patients that otherwise would be lost. I believe this provides a tremendous benefit.
Yeah, and so you mentioned that there's, I was going to ask, you said there's about 6 around the country. I mean, where is this on the, familiarity amongst the medical profession? How do you work with doctors? And, what, I know you said you focused a lot on ADD, and they're starting to get into some stuff around autism. I mean, what's kind of the potential of what type of situations this could help with?
I think it's huge. I think this is just my perspective, but everybody, well, almost everybody, but nearly everybody has some sort of abnormal brain circuitry that's developed that's impacting their life, and even to the extent of, let's say, a CEO who's dealing with a lot of anxiety, stress, maybe some depression, difficulty focusing at work. Maybe they feel like they've lost their edge. To high-level athletes, I think there's a lot of potential for even those people who don't really have maybe a formal diagnosis, but to sharpen the ability to focus, to concentrate, and so improve the output of whatever you're doing, whether it's running a company or running a 100-meter dash or something like that.
Interesting. And then, but still pretty small scale. It's right. There's only a handful of places so far. So really just in the basic therapies that are, this is FDA approved, if I understand, for, as you said, for ADD, or where is it on sort of that regulatory schema?
Yeah, good question. So it is approved for depression and OCD. Everything else is so-called off-label. But you realize what it takes to get something approved through the FDA. It's millions, if not hundreds, tens, if not hundreds of billions of dollars, at least in the neurointerventional field. And there are a few companies up in the Santa Clarita area that are going through FDA approvals for a variety of neurointerventional products. It's extremely expensive. And so you know, if you're talking about a surgery or an implant or something like that, then obviously it has to be a lot more rigorously defined, and the patient has to be protected. There are some studies that have been done in this field. Actually, there's a lot on TMS. It's approved by the FDA. Getting that approval for all these other indications, such as anxiety, sleep disorders, I don't think that'll ever happen. And I think it's behooving on someone like me and my group to come out with the white papers and to come out with the studies that are supported by IRB approval, Institutional Review Board approval, that shows that we're doing everything safely, and to show what our outcomes are. And I think the proof is in the pudding. As a neurosurgeon, I get referrals because I treat a patient, they do well, they tell their next door neighbor, their aunt, their uncle, and especially in the Santa Clarita area, I think that's where this is going to go in the near term. Oh, I've been treated with TMS. I had this problem. Look at the results, and that referral base will grow. We also have a center down in the Valley in Encino, but again, I think that there's going to be a lot of increased interest over time, because I think people are sort of fatalistic and about the use of pharmacologics. And I think over time over time we'll find that people will be seeking this out more and more because of the benefit that they've heard.
Yeah, I definitely think they're much more cautious around pharmaceuticals, especially in wake of things like the opioid crisis and non-invasive techniques. I mean, I think people would at least want to try that before they went to invasive techniques, right? Or an additional medication. So you have two centers. What are your plans? What is your vision for how where this goes next?
Well, a lot of this involves communication with the primary doctors. And as we're talking with primary doctors, they're seeing their patients benefit from this. Also, psychologists, psychiatrists, they're seeing their patients benefit from it. We can start to expand out. It requires you to live fairly close by to the treatment center. So I think people won't travel more than probably 45 minutes. You have to come every day. So 45 minutes each way, it's an hour and a half. So we can put a center, in the northern part, the eastern part, closer to the 14, closer to the 5, and then the North Valley. But I think a lot of this is going to be, word of mouth, and some of the studies that we're already working on right now. But I'm really excited about it. I mean, I think it's a paradigm shift in the way that both patients and doctors look at a lot of these diseases that were, I hate to call them diseases. They're really, let's call them burdens, cognitive burdens. And that's the other thing. I don't want to make this seem like where I don't want to make it seem like we're treating mental health as opposed to improving or optimizing your mental health. Because frankly, if you have anxiety, you have some OCD, you may be able to compensate quite well and be very successful in what you do. In fact, some of those entities or burdens, if they're are beneficial to people to be able to live their life. The point where it becomes a burden, really, and starts to have a deleterious effect on daily function, whether it's interpersonal or business-wise. That's where people are seeking other avenues, and people don't necessarily talk about their anxiety, their OCD, their sleep disorders, their anxiety, their addictive behaviors necessarily with their primary doctors, because they know the response is going to be, well, I'll give you a pill, or I'll go see a psychiatrist. And I'm not saying that's necessarily bad, but for so many people, they know the end result of that is try this drug with side effects, try that drug with side effects. And for many patients, that's the only option. But I'd like to introduce the concept that there are other options available. And I think brain neuromodulation we're at the forefront of some really big things in the future. I mean, you see, someone like Elon Musk talk about his implant system, and even to the extent of what I do on a day-to-day basis. When I started deep brain stimulation 20 years ago, people were obviously very afraid of the intervention, and were hoping that, well, can't I just take a pill to fix my Parkinson's? But nowadays, people don't talk. Okay, doc, I'm ready to go. When are we going to do the surgery? So there's like society has become comfortable with the concept of neuromodulation, and so I'm excited about the future of TMS for the community and for the population as a whole.
Well, Mark, thank you first off, for explaining all of this to us and for introducing this alternative and this option for our community and a whole lot of people who I think could, who hopefully will find benefit from it, or at least be able to explore a new option, a new therapy for them. So really, thank you for what you're doing here. It's really fascinating to me. I think this stuff is all really, really cool. So we're glad to be part of your communication strategy, and we wish you very much success as things move forward. Thanks again for joining me.
Thank you, Holly. It's a pleasure, and thanks for the invitation.
And thanks, everyone, for listening to SCV Means Business. Please subscribe wherever you find your podcasts, or catch us on YouTube, and we'll see you next time. Have a great day. Thanks.